Welcome to the VitaLife show. I'm Dr. Janine Bowring, and today's topic in our VitaLife show is all about how to treat plantar fasciitis naturally without using any drugs. I have some great tips and exercises and massage techniques to show you that you can really treat this effectively, safely, and naturally at home in the comforts of your own home without any side effects of any drugs, because you know the natural things that you may be trying may not be working for you, and of course the conventional medicines that are out there have those negative side effects. They're very difficult on the stomach, can cause stomach bleeding. So those anti-inflammatories and painkillers that are conventionally given to you by your doctor really do have a lot of these negative side effects that I really don't want for you. So stay tuned. We're going to show you some great things that you can do for your plantar fasciitis. Very effective, works very quickly. I do this with my patients and have over the years with great effectiveness. So first and foremost is stretching, and this is so important. So of course, plantar fasciitis, I'm going to show you, I'm going to take my shoe off and I'll show you exactly how we do this, is of course a painful condition at the bottom of the foot. And this is because, of course, the tendons and the fascia is being pulled in this area. And often it's because of the gastroc. So the calf muscles are very tight. So this is true, you know, not only just for athletes, but for people that don't stretch enough. And this can be really at any age. Of course, as we age and our mineral imbalance gets out of whack, and we'll talk about the minerals that you can take to help the plantar fasciitis, what happens is that this can get worse and worse. So I find that this is an area of a lot of tenderness for so many people, even if it hasn't developed into the plantar fasciitis yet. But one of the important things to remember is to always stretch your calf muscles. Now, how do you do this? Well, one of the great ways to do it is actually to put your foot up against a wall and stretch the calf muscles. This way, you can also sit down on the floor with your legs stretched out in front of you straight, and of course, try to touch your tippy toes and go as far as you can. And not only is this a great stretch for your hamstrings, but also for those gastrocs or your calf muscles, which is so important. And it's important always when you are exercising to warm up your muscles a little bit, then do your stretching. So you need to warm up at least 10 minutes or so, get the muscles, the blood flowing, get everything nice and warmed up, then do the stretching. And of course, after exercise as well, you have to make sure that you stretch, especially those calf muscles, and especially if you have plantar fasciitis. The other thing you can do at home is to massage. So with your thumbs, you basically grab your foot and really just dig right in there. And this can be very, very painful at the beginning because there's all that tension and almost like scar tissue that's built up in the fascia, but you really have to work it out. And sometimes you can actually hear it's like a crinkling, crumping sound that happens within that area because you're actually starting to break down some of that toxic residue that's in the bottom of the foot. So work on that. I usually recommend the massage for my patients, if you can, 5 to 10 minutes a day, especially when the plantar fasciitis is really acting up. Of course, you can see your massage therapist to help you with this as well, but that can, you know, get quite costly, especially if you need to go all the time. So this is something, you know, that you can do, or get your kids or your husband to be rubbing your feet and getting at that tension that's in the plantar fascia. The other thing that I love is yoga exercises. So just even a general yoga routine will help you to stretch. Of course, thinking of downward dog, great stretch, especially for the calves and the hamstrings, but also helps to stretch the plantar fascia at the bottom of the feet. And there are specific yoga moves as well that you can do for plantar fasciitis. Now, I promised I would talk about the minerals, and this is what a lot of people don't realize, is that there's always a balance going on and a dance between magnesium, calcium, and vitamin D3. The proper absorption of these nutrients is essential. If you don't have enough calcium, then often you're depleted in magnesium. If your magnesium is depleted, then your calcium gets out of whack. So you really need to use all of these nutrients together. And of course, the D3 helps the absorption of that calcium. So not all minerals are created equally. When you're supplementing with these things, you can't possibly get enough of these minerals in our food anymore. So they really do need to be supplemented. So that's what I recommend, that magnesium is always taken in the morning and not with your calcium. And a lot of people don't realize this. For best absorption, you take your magnesium separately from your calcium because they actually compete for absorption. Comment below, ask me your questions and give me your comments about this video. Check out all of our videos for the VitaLife show. We have hundreds now here on YouTube, so be sure to leave your comments and your questions. Like us on Facebook, follow us on Twitter at VitaTree. And remember that your health is in your hands. You have the ability to live a healthy and a vital life.